Right, 18 minutes to the top of the hour. According to Autism South Africa, autism is a complex group of neurodevelopmental disabilities considered to be a spectrum, as each person has different strengths, abilities, and requires different types and levels of support. The World Health Organization reports that 1 in 100 children are autistic. Today, we turn our attention to autism awareness. And joining us in studio is Leryke Kleynhans, a dedicated autism therapist from Autism South Africa. She's also living with autism, an adult that has got it, so it's going to make even a better conversation so that we can, of course, really get to understand how it works. Our guest as well that we do have, who's joining us via Zoom, is Ayanda Larkin-Harrison. She's the founder of Vuyolethu Haven, and she is with us as well via Zoom. Ladies, thank you. Thank you so much for joining us. I'll say hi to you, Ayanda, because you're not in studio with us, just so that we include you into the conversation. It's wonderful to have you.
Good morning. Thank you for having me.
It's an absolute pleasure. And Leryke, thank you. Thank you for coming in and talking to us this morning. So, Leryke, let me begin with you. Perhaps you want to just tell us a little bit more about yourself before we sort of start engaging in the conversation.
Yes, so I'm an autistic adult. So autism is a lifelong condition. So you're not just having it as a child, you're autistic the rest of your life. And I was late diagnosed, which is quite common in our female population, that there's a bias towards our male population, and our females often get diagnosed a little bit later in life. So I was diagnosed in my late 20s.
In your late 20s? I mean, that is... You basically had already lived a lifetime not knowing that you were autistic. How did you get through? How did you get by?
There's a lot of being late diagnosed. There's a lot of personal understanding. There's a lot of understanding that other people around me could have of me that was missing because the diagnosis was missing. Yeah. And there's a lot of then you have to, if you get the diagnosis later in life, you have to go backtrack and go recontextualize all of your experiences in terms of this new diagnosis that you got. Yeah. So I wish that I could have gotten the diagnosis younger. I think people are scared of the stigma, so sometimes people are scared of diagnosing, but it's really beneficial to know yourself this way. Yeah. And I hope that there could be more research and more understanding of autism in our women and our girls.
Leryke, I'm going to speak to you more about this because, I mean, I find it exceptionally fascinating about this late diagnosis and the difference between young boys and girls being diagnosed at different times. And perhaps, Ayanda, we can bring you into the conversation here because, I mean, you've got this Vuyolethu Haven, and this is something where obviously people come, they try and get assistance and help. But just listening to Leryke's story, is that something that you hear of quite a lot, the late diagnosis or children not being diagnosed early enough to receive the right treatment?
Absolutely, especially when it comes to women, because we have a remarkable ability of masking. So your guest was masked for 20 odd years. And she conformed to society, she did everything that she was expected of her. And a lot of our young ladies, and I'm not sure if this is what your guest experienced, they experience what you call autistic burnout. But it comes to a point where you just can't do it anymore. Yeah. And then those behaviors can be detrimental. So a lot of the girls or young people will go through a major depression, or they could possibly self-harm, and they become very vulnerable in society because they're so eager to please that they become vulnerable, and they will do anything in order for them to fit in, and that makes them really vulnerable in the community. Yeah. So yes, the late diagnosis is really a big deal within girls, but also within children, especially within the Black communities, because we don't want a label. So people will put it off and keep labeling it other things like, oh, this child is naughty, or especially with the boys, he's little, he's a boy, they develop later. And during that time, you're losing some valuable years where you could be, number one, understanding your child's situation, or secondly, just getting some support in for that child at an early stage in their life.
Incredible, and because it is so true. I mean, the earlier that you can start getting assistance and help, the better it is. Ayanda, the Vuyolethu Haven, perhaps you want to give us some information about why you decided to start it and how does it actually operate and work?
Okay, so we established that there is a desperate need for support, especially within the Black community and the disadvantaged community, that there's a massive lack of understanding and lack of knowledge, and there's a big stigma around autism. So that is the main reason why we Vuyolethu Haven came to being. It was just to create that level of understanding, the level of education that people require. Also part of our organization is going into schools and working with mainstream schools and specialist schools and just teaching them and helping them understand what autism is and how they can support these kids within a mainstream school. So you don't always have to go to a special school or remedial school. It's just small tweaks that schools can do to support and accommodate young people whilst they're in a mainstream school. Yeah. And if it comes to a point that they need to go to a specialist school, that child is prepared and that the school that they're going to is prepared to receive child X.
Yeah.
So that's the reason. Yeah.
And the reality to get into one of these specialised schools is very, very difficult. And I know that was one of the broadcasts that we had done at Karama School. And this was, I mean, when you hear the waiting lists to try and get your child help, it's very, very difficult. Leryke, let me come back to you now because you're quite fascinating in what you do. So late diagnosis, you are an adult with autism, but you're still a therapist. So you help and assist those that do have autism. Talk to us about that.
Yes, so I'm an occupational therapist, and I studied occupational therapy before I knew that I was autistic. I just knew that I wanted to help people. And I think that autistic people's brains work differently. So the best people to know how autistic brains work are people that have autism, autistic people ourselves. We know what's internally happening, what's behind all of that behavior that people are externally seeing. Yeah. So it really helps me understand my patients, my clients, and what they're going through and what type of support they need. And it really helps me to take a neuro-affirming approach. So the approach we take is not that you're autistic and we need to fix it, we need to make you less autistic. Rather, our approach is that because you're different, the world isn't very much matched to your needs. So we want to bring the world to you. Yeah. We want to have the environment match your needs a little bit better and the people around you understand and accept you a little bit better.
Did you go to a mainstream school?
I did go to a mainstream school.
And I mean, that must have been quite difficult for you in a way. I mean, because obviously I know that there's different degrees of severity of autism and on the spectrum. And perhaps maybe you can help me and the viewers better understand that. Because, I mean, for you to have gone through the schooling system, undiagnosed, and then still go on to study occupational therapy, I mean, you must have performed and worked exceptionally hard to get through this.
I think that autistic people can have strengths, and I used a lot of those strengths to compensate. And then, like she said, I went to varsity, and a lot of those safety nets, a lot of the things that I used to compensate in school kind of fell away. Yeah. And like she said, because you have to mask all of the time, so masking or camouflaging is when you hide your autistic traits, because you can see that people negatively respond to your autistic traits. So to fit in, to be able to integrate into society, you hide your autistic traits as much as you can, but it does lead to burnout. And that's what happened to me in varsity, is I had big burnout, because especially autistic women, instead of having the meltdowns where you're yelling and maybe you're kicking and all of that, all of those feelings of being overwhelmed just gets internalized. So they are turn into anxiety, they turn into what we call shutdowns. So you kind of disengage with the world and with your environment because you're so overwhelmed. And that was what was happening with me a lot. And because it's a shutdown, nobody is noticing, nobody is caring or worrying because it's not that visible that you're feeling overwhelmed.
So Ayanda, quite an important question, and I think that this one is for adults, for parents and anybody that may have any symptoms of autism that's being completely undiagnosed. Obviously, there are those cases that you cannot miss. I mean, there's no way that you can mask and hide the fact that you have autism. But there are some people, as Leryke, that manage to mask it. But talk to us about the signs that we need to look out for in children that can be successfully diagnosed and treated for this.
I mean, I'll prefix it by saying I'm not a medical professional, so these are just general signs that people should be looking for. Autism, a lot of the difficulties stem around communication and interaction. So when your child is struggling to interact and communicate, that's a big sign for you to pick up. Say, oh, there possibly something's going on here. You also need to look at like Leryke. Is it Leryke? She's an OT, so she knows all about the sensory needs. So there's a lot of sensory needs when it comes to children with autism. So it could be oral, it could be motor. So you need to look at all of those traits as well. There's also a lot of repetitive movements. So a lot of these children will be flapping or spinning or walking in straight lines or doing the same thing over and over again, or watching the same program, like, I don't know, Peppa Pig. They'll watch a specific bit of Peppa Pig, but they'll watch it 500,000 times in 2 minutes. It's just that repetitive behavior that they have. So that's a definite sign that something is amiss. And a lot of the more severe cases, there's an issue with speech. So a lot of these kids will lose their speech. I know for my son started off having words, and at a certain age, it just stopped. So that was a clear sign that there is a concern here when it comes to verbal communication.
Yeah.
So those, I think, are the telltale signs when it comes to autism and behavior, especially the boys. The boys, unlike girls, lack the ability to mask. So they will tend to have your violent meltdowns. They will tend to scream, shout, kick for reasons that we think are unknown, but for them it's anxiety, it's built up and they just can't manage anymore, and they're communicating that through their behaviors.
Yeah.
So those are the signs that I would look for.
Goodness me, Leryke and Ayanda, I just want to continue talking, but we've run out of time. But it is, I mean, it's a vital issue. You need to look out for the signs, and when you do, where do you take your child? I mean, that would be one question I'd have to ask you, because some people cannot afford the very high level support. But where do if I think my child's got these symptoms, where do I take them, Leryke?
So there are neurodevelopmental clinics. You take your child to a pediatrician or a neurologist or a psychologist, some psychologist or psychiatrist, and they do the assessments. They check that there's not other underlying diagnosis that's causing the behavior, that it is autism. Autism can't be diagnosed through brain scans or blood tests. They have to go and look at the child and talk to the parents and get that history, and that's how they diagnose.
Leryke, thank you. Thank you so much for talking to us and for the work that you are doing in this field. And Ayanda, to you as well, and to your Haven, thank you very, very much for your time. Both of these ladies really helping us out and helping us understand the intricacies around autism. Let's quickly take a break, and we have to say goodbye to you after this. Do stay tuned.